one. This is probably one of the most important medicines and topical actives that we have, if not the most important. In dermatology, we use both retinols and retinoids. Retinol, which this product is an over-the-counter vitamin A. Retinol is just another name for vitamin A. A retinoid is a prescription strength topical that is a vitamin A derivative. And usually, these molecules are shifted so that they produce more of an effect. And that can mean more irritation and more benefit. And so in people who are just starting with a vitamin A, I usually do recommend that they use an over-the-counter retinol before we go to prescription retinoid, because a retinol will give them, nice improvement in their skin tone and nice turnover of the skin without irritating them. For you, Michelle, this is a good time to start. Your 40s are a great time to start doing some anti-aging skincare. This one is good because this one is encapsulated. That just means that the retinol molecules are sort of, oh, Michelle, I'm sorry. I didn't mean to reveal your age to everyone. You're 25. Um, the encapsulated retinols are nice because they are very easy to tolerate. So they kind of penetrate deeply without causing a lot of irritation. And that's what it means when a product says that the retinol is encapsulated. A retinol is also a fat-soluble molecule. It can be used in other formats, but using it in an oil form is sort of the best way to get absorption of it, because that's where the molecule kind of wants to hang out, in sort of an oily, fatty vehicle. So this is an oil. Another reason why it's nice to have an oil when you put on your retinol is that an oil is very moisturizing and soothing. And so when an oil is, because you're combining it with moisturizer, means that you're less likely to get redness and peeling, which is what happens when you kind of overuse retinol when you first start. Anyone should be able to use retinol, or most people will be able to use retinol daily or nightly, but you have to just get used to it. So I'll tell people to start once or twice a week, and then you slowly build up to 3 times a week, 4 times a week, 5 times a week, until you're tolerating it or until your skin is retinized. If you do it every day before your skin is retinized, you will get red and peely. A lot of people kind of stop early thinking that it means that they're allergic or they're sensitive to it. They're not. It's just you haven't given your skin enough time to adjust to it. At least you know that it's doing something, which is nice for a topical skincare product that you're going to end up spending money on. Beth asked, should people older than Michelle use retinoids? Retinoids, I mean, you should, even people in their 20s will start using a retinol or retinoids, because it helps prevent skin cancer by turning over the skin, helps prevent acne. Some people, unfortunately, will get acne into their 40s and 50s even, and so retinol can be helpful for that. It's anti-aging because it stimulates collagen production. So retinol does a ton of different things. Another thing that it does is to help reduce pigmentation. So just kind of in turning over the skin and making the skin turn over a little bit faster and healthier, it helps shed hyperpigmentation. So in people who struggle with hyperpigmented patches or brown patches like melasma or post-inflammatory hyperpigmentation from acne marks, the retinol is going to help shed this pigmentation faster. It stimulates your fibroblasts to make more collagen. So in that sense, it's anti-aging. Because it turns over the cells a little bit faster, damaged cells that are sun damaged and kind of wanting to form precancerous spots or even skin cancers will shed will shed as well. And so that in that way, it's sort of anti-skin cancer. So retinol has a ton of really, really good properties. Beth asked what products shrink pores, the glycolic peels. Retinol can help with the appearance of pores by reducing the oil production in the skin. You know, pores are normal to have, and it's not normal to have kind of poreless skin that you see in Instagram filters. It's normal to have some pores, but a lot of people will come in wanting to reduce this appearance of their pores. And the way that you reduce the appearance of pores is by reducing the oil production in the skin. Retinol will do this, and also niacinamide is another thing that will do this. Glycolic acid and salicylic acid, those will also help by sort of clearing out the pores so you don't have little sebaceous filaments or little blackheads forming. So glycolic acid in that sense can make the appearance of pores less. What else? Retinol. So retinol is a really, really important thing to use. So other than sunscreen, I would say retinol is kind of the most important active that you should be using if you want to kind of help the health of the skin and reduce signs of aging. The third active that we can talk about is vitamin C. Vitamin C is another really popular one, especially among dermatologists. And so, oops. And so this one